What's going on, guys? Welcome back to another episode of No Rain, No Rainbows podcast. Glad you're with us today. If this is the first time you're listening, this is a podcast about getting through your hard times to live your best life. Life is hard, but it's worth the squeeze. You can't get the rainbows without a little bit of rain along the way. We all have those storms that we have to get through. Joining me today, we have a duo interview that we're going to be doing. Please welcome my guest for today. We have Dr. Mariya Shaeffer, right?
Yeah.
And we have Dr. Raymond Nichols. Yes. I want to say like the chiropractic duo. How you guys doing?
Good.
Doing really good.
So really quick before we jump into the episode, how about we first introduce you to our viewers and our listeners? Why not introduce yourselves, tell us where you're from and what it is you do.
All
right. So I'm Dr. Raymond Nichols. I'm originally from Laura, Mississippi. Went to chiropractic school at Life University in Atlanta and then moved here to open up a practice starting April 1st. So we're 4 months in and we're really loving what we do.
Nice.
And I'm Dr. Mariya Shaeffer, and I'm originally from Akron, Ohio, and we are here in Greenville, and I specialize in pediatrics and prenatals, taking care of that population in this office.
Wonderful, wonderful. So I guess my first question is, how do you get into chiropractic? How is that something that piqued your interest? Did you fall into it? Was it something you both have thought about doing for a while? Is that where you two met?
I can answer that one. So we both met at chiropractic school, day one, actually pre-day one, when we were doing a tour of the university, and he just has been after me since then. But chiropractic is a lifestyle. We didn't initially see ourselves in chiropractic growing up, but we both kind of fell into it, and it led us here, and it's meant to be.
Nice.
And as far as just me in particular, what really strikes my interest about chiropractic is that natural, that holistic aspect of it. And I remember, I tell you this story all the time, I remember when I was 8 years old, and I grew up in a medicine cabinet like most people do. And this one time I had a sinus infection, a real bad sinus infection, and I don't know what it was, but when my grandmother came to bring me the medication that she always does, she's my hero, I just told her, hey, my body's going to heal itself. I don't need the medication. 8 years old, I told her that.
Wow.
Yeah. So I don't know what it was. I don't know if it was subconscious or I'm just a genius, but I told her that, and I just knew that the body had the capability of healing itself from inside out opposed to outside in. Mm-hmm. And that philosophy, that aspect of chiropractic is what resonates the most with me, and that's why we are here. Yeah.
So I'd love to unpack the holistic aspect of it, but something you mentioned, Mariya, you were saying chiropractic is a lifestyle. Elaborate more on that, on how it's a lifestyle, and because a lot of people might not know about it. I mean, the average person I know, they'll say, oh, who's your doctor, but they don't mention who their chiropractor is. So kind of open the door to this lifestyle that many people might be in the dark about.
Yeah, so it's a lifestyle, and in that sense, it's kind of just like everything in one, all of the natural health care. It's not just coming in and getting an adjustment. It's the supplements you take, the vitamins, the food you eat, any kind of products you use on your body, the water you drink, your headspace, everything. So physical, mental, it's all of it.
Yeah, head to toe, inside and out.
Yes.
Yeah, and that's kind of bridging perfectly into the holistic aspect of things. Raymond, when you mentioned, you didn't want the medicine because your body will heal itself. A lot of times you go to the doctor, you say your arm hurts, they give you something because your arm hurts, but that's the symptom, not necessarily the cause. And I think a lot of people, they focus on handling the symptoms, they don't focus on handling the reasoning or the cause behind their arm hurting, what's really causing that. So I guess jumping into the holistic side of things, how do you dig down to the actual problem and not just treat the symptoms?
So in our office, Alignlife, so we actually focus on exactly what you're talking about. So not trying to just cover up that symptom, but actually let's find the root cause of this problem and let's fix it, right? Because they don't want you to just come in here and then you leave and you end up doing the same things you've been doing. You get those same results and you end up right back in here and you tend to be in worse condition than before. So we like to actually fix that problem. And we do that numerous ways as far as finding it. We do full examination We see exactly where the vertebrae is not moving properly. And then we also take x-rays to confirm a subluxation, which is a misalignment of the vertebrae. But those are some aspects that we do to try to find the actual problem, right? Because a lot of people don't know that. They think chiropractic is about the pain and things like that, but it's honestly, it's really not. Like I feel like that's like a good side effect of chiropractic. The pain's definitely going to go away. But what we're really trying to do, we're really trying to connect your brain to your body and making sure that those things are talking to each other and listening to each other effectively. Because if they're not, then your body isn't healthy, right? Your brain and spinal cord literally controls and coordinates every other system in the body. Yeah. It makes sense? Yeah.
I was going to ask, elaborate a little bit more for folks on how exactly is the brain and the body connected? How do those two gaps bridge together?
The brain is literally connected to the body through the spine. That's the nervous system, and that's what we focus on. We are nervous system based doctors. We're not looking for a back crack, a neck crack. We are looking to the spine for the cause of the problem, because anything that's affected in your body, the 3 trillion cells, it's coming from that spine, the nervous system. So the communication to your body and to your brain has to be clear to effectively communicate. If not, you're going to get symptoms, and that's that.
So what are some of the things that disrupt that communication?
So we call it a subluxation, and a subluxation is literally just the bone moving out of place, and it's putting pressure pressure on the nerve, and it's just causing dis-ease in your body. So that is what the subluxation is, and that's our big word for saying that it's not a dislocation. It's a little bit less than a dislocation, but it's still out of place, and it needs to be put back into place.
Yeah. Now, I know for a lot of folks, they live their life through habits, right? And sometimes these habits are kind of what can lead to the subluxation.
Yes.
Got it. Nice. 2 points. But these habits, they do them for a while, and the pain might not be instant. It might take months, maybe even years before pain presents itself. How do you when you're treating somebody, you're not just treating the body, you're kind of treating their habits. How do you alert them to the habits that they're doing and kind of help them break some of those bad habits or start new habits that can serve them?
I'm going to chime in and then let you take it over. So we alert them by education and awareness. So we bring the awareness to them that these habits are bad for them, and then the ball's in their court, and they have to take it over and deal with it. So you go ahead, because I know you love this.
But yeah, you said definitely you can't make anyone do anything. I think the first thing that comes with change is being aware that something is a problem, because a lot of people don't know that they're actually doing these habits on a daily basis. Like it's a subconscious thing. They're just literally going about their day, sprint to sprint. So these habits is something that's caused this subluxation, like you said. And these habits could be anywhere from sleeping, like sleeping on more than one pillow. Literally you're literally jacking your spine out like this. So we sleep 1/3 of our lives. Bad posture, sitting at desk all day. Exactly. All right. Society has definitely put us in this position here, where it's putting a lot of strain and stress on our spine and our nervous system. It's doing definitely detrimental to your overall health with that. But yeah, habits is a big thing. And like she said, I told you, we believe that informed people are more likely to make those informed decisions when they know better.
Yeah.
Simple as that.
Yeah. And if no one ever tells them, how are they going to know
Exactly.
better? So a question I want to ask selfishly, because you mentioned we sleep 1/3 of our lives. What is the best position to sleep in? Because I try to sleep on my back, and then I'll wake up in the middle of the night, I've rolled over to my side, and that's really kind of giving me shoulder problems. So what is the best position to sleep in? I know anyone listening right now or watching on YouTube, you probably sleep too, so this question might serve you also.
So there are 2 positions. On your back is one of them, and you have to do it properly. So you want your neck to be supported or on your side, and then you want to make sure that you have a pillow between your legs to support the natural alignment of the spine and the body.
Okay, so would you recommend, because I know comfort for mothers who are pregnant, or expecting mothers who are pregnant, expecting mothers who are pregnant, because I've heard how some try to sleep on their side, they don't get comfortable. Do you have any recommendations for that?
you're never going to be comfortable in pregnancy sleeping, but the best position is on your left side because of the blood flow to the uterus. So on the left side is the best side when you're pregnant, and you use any kind of pillows to make yourself comfortable to sleep at night.
I had to get those selfish questions out of the way. Thank you. Thank you so much. But so when you talk about the interruption between the brain and the body, and this is the part of the podcast, anybody that's listening, I encourage you to go to the YouTube video and watch it, because we're going to do some demonstrative stuff here. You have a couple models in front of us. This, which I'm not even going to try and say what the model is. But you were mentioning you can't move one piece without moving the rest. I guess kind of explain to the viewers watching on YouTube, and the listeners could still get value from this too, to describe the model. It's, I want to say 2, 4, 6 sticks that are connected with tight rubber bands, and if you move one, the whole entire thing moves. What's the idea behind this?
All right, so the model that he's speaking about is called a biotin segre model. This is, I would say fairly new within the realm. It's not about looking at the body like we're just separate parts, because we are a whole, and that's holistic, right? Yeah. So we are a whole, and that's exactly what this model represents. So the wood here actually represents the bones in the body, and then the rubber bands actually represent the ligaments, the muscles, tissue, all those things. And you could see that no bone is actually touching another one, right? Same thing in the body. There's no bone actually touching one another. There's something in between each bone if you really think about it.
Okay, like the cartilage.
Yes.
Oh, wow.
So that's all interconnected. Yeah. So that's what this represents. And going back to the habits that we were just talking about, and then that's what happens when we have these daily habits, daily essentially, right? So when we have these daily habits, our body gets in these distorted patterns, in which our entire body gets distorted, and it can literally get stuck in this position. Wow. So like you said, I can't move just one part of this without affecting the entire model. Yeah. Same thing in the body.
So for the folks listening at home, when he's pushing one of the 6 sticks, really the whole thing kind of pinches itself, and some bands will stretch, some compress, and you're pretty much saying if you alter one part of the body, the rest of the body is going to have to alter itself to compensate. Yes. And what kind of problems can that lead to?
It can lead to, that's a loaded question. That is a loaded question, because it can lead to a lot of things. It's seriously, yeah.
I'll chime in. Anything musculoskeletal, so any kind of aches, pains, and then also anything that's internal, organ problems, allergies, asthma, all these things can be caused by the distortion of the body.
Yeah, and now Mariya, so you kind of focus, we're talking about habits, and usually they're instilled at a very young age, and with your expertise on the pediatric side, how important is it for parents to not only seek out this information and learn, but kind of pass on what they learn to children who, I mean, if you see a baby squat, it's like they come out with perfect form.
It's amazing.
Seriously.
Yeah, they're learning literally from the ground up. So that's why we love to see kids, because it's easier for them to grow healthy rather than us trying to fix unhealthy adults. So they're already establishing good patterns when they're coming in and getting their spine checked and remaining subluxation free. They're living healthier lives.
Okay, so kind of finishing up really the topic with chiropractic and everything, what are some of the gems, or if parents are listening, maybe some teenagers are listening, what are some of the gems you'd want to deliver to them through the airwaves that they can start now to start taking care of their bodies in a holistic way?
Yeah.
That's a lot.
I would say, definitely a loaded question, but I would say just to start now, it would definitely be being aware of the things that you do on a daily basis. So such as being on your phone all day, looking down at your phone, opposed to just having it down here. You could just bring it up here, eye level. So now you're not looking down. You're not putting strain on the back of your neck here. So that's one thing. Just being conscious of your sleep that we just spoke about. So sleeping, because we sleep 1/3 of our lives, right? And then another thing that comes to mind would be...
I have one.
Okay, go ahead.
This is something I'm passionate about. Toxins. So we are very toxic people. So that's something that people should be aware of. And that's a lot of, just like all of our products are so toxic. The fragrance we wear, anything we wash our body with, the products we clean our home with. So those are easy fixes that can establish good patterns and take those toxins out of your life and make you healthier.
Yeah. All right. Well, I love it. So I want to transition a little bit to, you're running a practice together, engaged.
Yeah.
So not only are you running a practice, you both have the love of chiropractic, but you have the love between you two. How do you balance all that? We talk about no rain, no rainbows. I know it hasn't been all rainbows through the whole process. So what are some challenges you both have experienced in moving to Greenville and starting this practice together?
I think some of the challenges that come up are separating home from work, because it's hard to do because we're so fresh into practice that we're always like talking about work, and sometimes it's just like, all right, we need to relax and not talk about work right now, like give ourselves a few hours. And then another would be the roles, what roles we play in our new life, basically, because we have a kid as well, so there's a lot going on. We're running a business, we're seeing patients, we're parenting, we're being partners. It's a lot, so it's hard.
Well, unpacking it for some folks, with whatever you're comfortable with sharing, of course. What are some challenges that stick out to you that you've overcome throughout the process? I know you mentioned, schooling itself, when when you're trying to be a doctor, I know that's not easy in itself. The testing, the information, that has to be difficult.
Yeah, so definitely kind of reminiscing on school since you brought it up.
The look of fear in his eyes.
Yes. So being a student, like you said, it's very, very stressful because we're on a quarter system, literally taking 25 hours a quarter. So that's every 11 weeks. That's really stressful. And then we had a child right there close to the end. So being able to find a babysitter, being able to sometimes have to bring her to class.
Shout out to my mom because she watched the baby a lot. She flew down from Ohio to watch the baby.
Yeah, so those were some big challenges, and also being able to study. We also see patients. We had patients, and we had tests. We had our boards.
Yeah.
You literally that's a lot of information, a lot of things that you're dealing with all at once. But we got through it. But at the time it was hard. It really was really, really hard. But we did find our way through it.
I think one of the biggest things is we thought it was going to get easier when we got out of school, because we're like, oh, we're done with all the hard stuff. But it really gets hard once you're in practice, and it's a lot different because you're making your own money now. And so we've had financial struggles along the way, and we get through it. We just kind of buckle down and budget. Yeah.
I love that you said that, though, because I think a lot of kids and young adults going through school, they look at graduation and they can't wait for graduation. They're like, oh, once I'm free, it's going to be easy. But I think, college and all that, it might sound cliche, but like that's just preseason.
Yes.
That's just preseason. Now it's game time. So how do you deal with some of the increased difficulty? What would you say is the main thing that drives you through those challenges? They say, for someone who has a why, they could withstand almost any how. So what kind of, on those rainy days, whenever if it's the budgeting, the baby's crying and you're up all night and then have to see patients in the morning, what are some of the things that kind of is like, well, let's get it? What pushes you through?
I think our job is very rewarding, and that's kind of what gets us through it. It's so rewarding when somebody comes in with a problem, or not even without a problem, and you just can see them through their journey and they're getting better and they're having just life-changing effects. It's really rewarding. So it's just like, we'll get there one day. Raymond says this to me all the time. It's the journey, be happy we're on the journey. So even when I'm getting down on myself and like, oh, we're not making enough money, how are we gonna, whatever, we can't do anything, we don't have we have what we need, we don't have what we want. And he's just like, we're on the journey. Yeah. We're here. Be patient.
And yes, I do tell you that because it is a journey, and I look at like life is a journey, right? We're gonna have those mountains, valleys, but it's just, this is the moment that we're in, and let's just be present in this moment. That's how I like to live life, is just being present, not really worrying about the past. Definitely we have a future, but I want to be present in this moment, and I don't want to miss anything, because this is going to be really, really valuable for us in the future for doing things like this and getting this, like, hey, we went through this and we got through it this way. This might help you, right? So not missing these it is a struggle sometimes, not missing this struggle, but I think it is rewarding to have that.
I think you guys should take a lot of like pictures along the way, because as you're building your practice, you said you're kind of just getting into the start of it. One day you're going to look back at this time and wish you took more pictures on the paint jobs that you're working on, the designs and stuff. We all know it's a project, and if you're anything like my girlfriend, you want the projects to be done now.
That's me.
Yeah.
I want it now.
Yeah. But we know it's a journey, it's a process. I think, to your point, you want to be present in that moment. But when you get to kind of stop, smell the roses, and see how far you've come, it's going to kind of be good to have that reference point from where you started. Kind of looking ahead now, we say no rain, no rainbows. We've talked about the rain. What are some of the rainbows you're chasing? What's the, I don't want to say like the big goal. Let's kind of like look a little closer, 6 months, a year or so down the line. What are some of those rainbows you're chasing?
I can even say some rainbows now. I think it's really great to be able to work together because we have a little more freedom. Since we do have a child, we can still have a family because we're not tied down to working X hours, doing whatever. We set our hours so we know what we're doing and we get things done in those hours. And so we have a little more freedom, and that's a big rainbow to me. Mm-hmm. Yeah.
So as far as rainbow, I think it would be more regarding the practice. So I think once we are able to like hire someone at the front desk, I think that's definitely going to open us up to serve more people. Right, and that's what we're trying to do, to serve as many people as possible and educate as many people as possible, because they need it. People need it, and we love to serve people, and that's exactly, I think that's the thing that I'm looking forward to. So we can be in that room with those 2 tables, literally just serving just out of love. Yeah. Right.
Well, speaking of which, I've seen on an Instagram you posting of adjusting each other. Mm-hmm. Do you adjust each other and whatnot?
Yes, we do. And I think that's a big part of it. And I tell my patients that all the time, like, hey, I get adjusted once a week, right? Because I know I'm over patients all day adjusting them. These are habits that I'm aware of, but I'm doing something to counteract those habits. Mm-hmm. So I just use myself as an example for my patients. All
right. So Dr. Mariya, Dr. Raymond, where can they find you? Where can folks listening right now, if they're in the Greenville area or if they're not and they just want to follow you on social media, root you guys on as you build your rainbows, where can folks connect with you?
All right, so on Instagram, we have our name is Alignlife Pelham Falls. And then we have separate Instagrams, Dr. Raymond Nichols and Dr. Mariya Shaeffer. You can find us on Instagram, and on Facebook, it would be Alignlife of Pelham Falls. So you can find us at those 2.
All right, and I'll be sure to put those in the show notes and everything so folks can go ahead and click the link. And in this day and age, they just want to scroll and click, make it simple for them. So we'll do that and give them direct line. Before we kind of wrap it up, is there any last thing you want folks to take away? This being a podcast, if they're watching on YouTube, most likely someone's sitting down while listening to this. Maybe they're cleaning their house. This is a moment right now where they could be conscious of their posture or what's going on. What tidbit would you give them kind of going into their ears and giving them one thing to walk away with as we finish off the show?
That one thing?
For chiropractic wise?
It could be anything wise. Life, chiropractic, inspirational. What's on your heart right now?
I think as far as just life-wise, I think the finding that why, what really motivates you, what drives you, and find exactly how to serve people in that. 'Cause I think the service is the ultimate thing that human beings are put on this planet to do, is to serve other people. And once we start serving each other, it's going to be a beautiful, beautiful place. It is already, but it'll be even beautiful. Yeah.
Mariya?
I was too busy listening. One thing to take away, it's kind of off of his, but, find something that's rewarding to you. Because, like I said, it's so rewarding to be able to hold somebody's newborn baby and they trust you enough to adjust them. And it's so rewarding. So find something that you really find rewarding and do it every day.
All right. Well, thank you so much, Mariya, Raymond.
Yes.
Thank you.
Thank
Thank
you.
you.
Yes, and to all the listeners and folks watching at home, thank you for your time. Thank you for making it to the end. And just remember, it's a lifestyle. You want to take care of yourself. You pay attention to the habits that you're going through. And remember, you can't move one part of the body without the rest of the body compensating it. And pay attention to the connection between the brain and your body. If you want to reach out to Mariya and Raymond, I urge you to do so, to live more of a holistic life and really take care of your body, because anything you're working on, you want to be on this planet to enjoy the fruits of your labor. So it's important to start with the body. With that being said, everybody wants the sunshine, but they don't want the rain, but you can't get the pleasure without a little pain. Let's grow.